Maximum Health with your host, Dr. Ken Gray. With over 20 years in healthcare, Dr. Gray is a doctor of Oriental medicine and holistic physician fusing Eastern and Western healing. Dr. Gray is on staff at Jupiter Medical Center and in private practice with an office in Jupiter, Florida, where he resides. Dr. Gray enjoys being a physician as well as being an educator. His unique approach to holistic healing has taken him abroad to lecture in Baden-Baden, Germany, and treat sports professionals in Hawaii and Biarritz, France. He is co-author of several books on food therapy and the founder of the annual Star Summit Talks at the Norton Museum of Art in Palm Beach, Florida. Now it's time for Maximum Health with Dr. Ken Gray.
Welcome back, everyone. This is Maximum Health Radio Quality Living. Thank you for joining us. As always, we're available on all podcast formats, and of course, we are brought to you and supported by Vel Health. If you haven't downloaded your Vel Health app today, do so. You've been waiting for it. It's now available. And velhealth.com is also a way to do that. We have Zachary Mcvicker, Dr. Zachary Mcvicker here. He's from the Paley Orthopedic and Spine Institute, and among other places. He's had quite a journey for such a young man. Doc, thank you for joining us.
Thanks for having me.
There's so much we're going to talk about today because the landscape, the idea of musculoskeletal and orthopedics has changed and is changing, and you, along with the Paley Institute, is helping to lead that charge. So tell me a little bit about your background with orthopedic surgery. What got you into it?
Yeah, so I was an athlete when I was younger, had a few major injuries, and kind of derailed my athletic career, which wasn't going to go very far anyways. But I always said if I wasn't going to be a professional athlete, I would hang out with them. And so that kind of pushed me into medicine, then orthopedics, and then sports medicine. But I went out to LA for fellowship, and was around a lot of professional athletes out in all the LA teams, and had a different perspective on their training and their recovery and what it takes to be successful at their level, with mental health and everything else that goes with being a high-level athlete. And so I was really interested in all of that, and came down to Florida, and now I work with the Miami Marlins as one of their team physicians, and the Jupiter Hammerheads, and just took a lot of what I learned from them and brought it out here, and trying to apply it to just everyday patients, even if it's just a weekend warrior or anybody with an injury.
When you think of sports, obviously there's no question why there's so many injuries. I mean, it's brutal and repetitive and stressful on the body when you do something, no matter how simple it may seem to us, the observer.
Right.
When you do it over and over and over again, all sorts of things start to happen, namely arthritis, inflammation, and all that. So kind of just give an overview of this system, because what I've realized in probably doing some form of health and healing since I've been 18 and I'm 48, is that most people don't even realize how the body works in relationship to their actions.
Right. So one of the big things that happens is that people have either poor posture or form when they're exercising. I'm talking mostly about weightlifting or cardio type things, and they put themselves in a repetitive spot where a certain muscle, tendon, the joint, whatever it is at a disadvantage, and then they just repetitively injure it, and it becomes more of a degenerative type of thing. And so, it can lead to tears, it can lead to partial tears, and a lot of inflammation and pain. And, when things start to fully tear, that's when it becomes more of a surgical thing. But before then, we can get to it and intervene and get people back to what they want to do before it comes to surgery.
What does intervening look like, though?
So, we try to correct posture, with some of the physical therapy type things. And I sit with them in the office if it's like a shoulder per se. I will teach them correct form and how they should be, sitting and reaching and things like that, so that they put their shoulder at a better advantage and the rotator cuff under less stress. And then, medications and stuff, can help, but there's certain supplements and things like that we can start giving people and decrease their natural inflammation in their body.
How's that changing compared to when you maybe first started in this field and then to now?
So it was just medication, really. And then, it was either medication, injection, steroid injection, or surgery. I mean, that's really all it was.
It's standard. It hasn't really changed. And it's been that way for decades.
Right.
How do you see what you do and your experience different in terms of the unique presence that you build?
So I take a little bit of extra time to explain what's going on and the pathoanatomy behind it, and kind of what's underlying problem, and try to correct that more than anything. If it's a non-surgical thing that we can manage conservatively. I think that's really what it boils down to, is getting a good understanding of what's going on for the patient and then trying to correct that.
Yeah. How responsive are people to that? Because obviously there's probably a majority of patients, as you know, that are going to want the quick fix. So and you have to kind of be the guy to say, hey, I understand you wanting the quick fix, but that's going to lead to A, which is going to lead to B and C, and then D is going to be like, oh, you don't really want D. I mean, it's difficult. It is, because you almost have to. The more you care, the harder it is sometimes with patients.
For sure.
So how do you deal with that?
It is. I mean, that's a really difficult problem, because you got to get people to commit to what you're trying to get them to do, and sometimes that's the hardest thing to do, because they'll understand it when they leave the office, but implementing it is sometimes difficult. So you'll get the people who just want the steroid injection, but I kind of say, look, this is a reset button, but it's going to come back if you don't do the correct things. So you got to put in the work.
And how does that work? I mean, because I don't think most people know how cortisone works, and that's a good thing to share.
So like the most basic explanation of it is that it just decreases inflammation in the area. So wherever you're putting it, it does dissolve into tissue a little bit, and it decreases some of the inflammation, some of the pain generators that are there, but it doesn't change what's going on. It can actually make some things worse. If it's soft tissue like a tendon, it can actually make it weaker.
Why? Just because of the effect it has chemically? Is that why I know most will not do more than 3 injections in one area.
Right.
Because it really deteriorates.
Right, yeah.
So, and that's not always common knowledge or given by physicians, so I think that's important.
For sure.
To integrate into that, the decision making.
For sure.
You're healthy, you're fit, you're in good shape, mentally and physically. So there is something to be said about that, and choosing a surgeon that represents good posture, good, you know what I mean? Right. It's like, do I really want to go to a cardiologist for heart issues that's smoking on their break and overweight and yet you see that a lot of times, you know, someone that's basically barely awake when they're interviewing you and they're like, you're a cardiologist. So same with me. I try to maintain some form of decent health. Most people look at me and say, you're 48, that's a good thing. Right. Doesn't come without work and consciousness, and I'm not perfect. Sure. However, I do try to maintain some balance. What's some advice of balance for you dealing with such high stress and high level of interaction with people, with your patients' bodies? I mean, because this is not an easy job that you've undertaken, that you've a path that you've chosen.
Yeah, so, sometimes it's a little more difficult now because I have young kids, but I try to make time for exercise for sure. On a daily basis. I'm laughing because
it does change. When without kids, different story. Gym, sure. Wake up early, do this, do that. It's all about you. But kids,
in residency, working sometimes 100 hours a week, I still make time to exercise and stuff. And then now it seems like it's even harder with the young kids. But I think making time for yourself to still feel like an individual and doing something you enjoy is really important. Yeah.
Sometimes it means getting up earlier and because in the evening it's almost impossible.
Yeah, for sure.
That's when everybody needs you.
You got to get up before everybody else.
So exercise is one thing, and diet, and how do you balance that out? What's your philosophy?
Yeah, so I think for me, the way that I'm able to stick with everything and keep it consistent is just moderation. Everything is in moderation. Don't overdo anything, and still enjoy some of the things that you like, but just don't indulge too much.
Right. Now, what's your specialty in surgery? What's your thing that you love to do and work on?
So I do general sports medicine. So do a lot of minimally invasive things.
Weight bearing joints.
Yep. And then shoulders, knees, and hips. And I do a lot of hip arthroscopy.
But what do you like? What is your favorite?
I like hip preservation.
Okay.
So it's a hip arthroscopy.
Okay.
Yep.
So hips are a big deal.
Mm-hmm.
I mean, especially you get the labral tears.
Yeah.
Describe that, because that's one thing that eludes people in terms of what that is. And I have my way of describing it, but I'd like to hear your version.
So this is an extremely poorly understood thing that happens. So your hip is an extremely complex joint, even though it's just a ball in a socket. It's so complex because of all the soft tissue, and then it's basically your foundation of your body, your pelvis and your low spine. So a lot of things can go awry, but what it comes down to is there's a misshape. A lot of people have a misshape to the ball, which is the femoral head, and it will create an impingement, which is like an abnormal contact in the hip, and that will lead to tearing of the labrum. The labrum is like a gasket of two pipes going together, so it creates a suction seal of the hip, which creates negative pressure in the hip, spreads out the contact pressure. Okay, so
you got that, listener?
So that's a lot.
You're basically like a vehicle.
Yeah. So when you tear that, you lose that suction seal, and it can lead to arthritis. But the underlying problem is that abnormal contact.
Right.
So what I do is go in and repair the labrum, but more importantly, you got to create a normal shape to the hip. So we shave down bone and reshape things to make it more normal and not have that abnormal contact. If you do have that, it can lead to a lot of different things. Low back pain is a big thing at almost everybody.
Due to the instability. I mean, because that
torque.
suction seal or that lip, labrum, I always say labrum lip. It's like, when that wears down or is not able to help stabilize, it's a help stabilize.
Yeah.
Right? It's not the total stability.
It's
but
micro
it helps,
stability. Yep.
Right? Then you've got instability, and then other parts of your vehicle have to pick up.
Correct.
The workload.
Exactly. And then that abnormal contact actually creates, you can see this in studies, that it creates a torque across the whole pelvis and into the low back. So it can give you a lot of low back pain like that too.
Now, this is a hard question to maybe answer, but let's talk about observation and experience. We don't have to talk scientifically or purely clinically. In your experience, is there a way that with strengthening and maybe not doing cortisone, which would probably hurt the healing process, but with strengthening, good diet, maybe if they're overweight, weight loss, that some parts of the body can heal as far as joint and tendon tears or injuries?
Absolutely. So a lot of the degenerative things, which means like the things that are seeing abnormal pressure or just kind of wearing away over time, can certainly be helped with that. And a really good example of that is like a partial rotator cuff tear, and people with their shoulders are in poor alignment and posture. A lot of people become chest dominant, meaning they're rounding their back, and they go to lift something, and that creates pressure across the rotator cuff on that tendon. So it starts to fray and be weakened over time. So correcting that and doing the proper things, when they go to lift and reach for things, then that will certainly help, and it will strengthen the tendon back.
And it's not only people that have poor postures, people that have certain tendencies to do weightlifting, a certain way.
Yep.
They want this look, but they don't realize how it changes the dynamic of their posture and where their pressure is, and that they also are promoting more injury and actually, worsening the condition. So learning how not only to lift in everyday life, but learning how to interact with your fitness regimen properly.
Yep.
And that's why I'm such a big proponent when patients come to me. I say, you're right in not doing this, doing that, but you have to do some physical therapy. You have to do guided work, because if you go and you just try to rehab yourself or try to strengthen yourself, you might do it wrong, and the mechanics are going to be part and parcel to you going backwards, not forwards.
Yeah, you may think that you're doing it correctly, but having another pair of eyes watching you do it and correcting just subtle little things will really make a big difference.
It's because, most of the injuries that happen to us, and correct me if I'm wrong, are a lot of the little muscles. It's a lot of the little parts of our body.
Yeah.
It's not the big stuff that we like to work on because it makes us look good. It's the little stuff that, when I see a big, strong or a CrossFit or fitness person or whatever come in and they are injured, it's not because they were doing the things that they normally do.
Yeah.
It was picking up a quarter or picking up a child or
Right.
grabbing something off of the lower shelf in a fridge, because it was those simple mechanics that they disregarded as important, and those muscles that they didn't work on or help. And so now your big bulky muscles are fine, but those little guys. So I'm a big fan of, say, Pilates mat, right? And I'm not the smallest guy, but I do Pilates mat as part of my workout because of those reasons.
Yeah.
And when you're hurt, you're hurt enough, you learn lessons.
Sure.
What are some other things besides Pilates mat? And some people may not know what that is, but it's different than Pilates reformer. It's not the machine. It's where it's just your body and a mat, and you're using your gravity in different postures, very akin to some ballet forms and bar classes and things like that.
Oh, that's great. I think, again, getting back to balance is having a good routine with like yoga, stretching, things like that maintain flexibility, weight training and cardio. So all of it together is really important. So, focusing just on one, sometimes can lead you to that imbalance, and then you start, overworking something. So it helps with recovery and just training different muscles and them seeing a different load and stress to help, maintain an injury-free existence in your everyday.
We live in a community, and I'm sure this is universal. You might say you might mention yoga and you might mention all these things, and they say, "Oh, I stretch," or "I go for I walk."
Yeah.
What do you say to patients that tell you that?
Well, I ask them, how much do you stretch? And honestly, if they say that they're doing it once a day, I mean, we'll kick it up to 2, and keep progressing, or go to a formal class.
Right.
Really make a different effort, a different change than what you're currently doing.
Right. What about walking? What are your thoughts on walking?
I think walking is great if it doesn't if you're doing it properly and it doesn't affect you, and it's not painful. So I think it's a wonderful exercise, for your body and your mental health too.
Yeah, but obviously, if you have a labral tear,
and
you're walking, I'm walking, it's like, well, in this case, you might need to be swimming, right? You might need to think of other forms of. You do want to move, but it's just the proper application of movement and mechanics that are going to help you and not hurt you. So that's the moral of that story. Let's get to some juicy stuff. There's definitely always sports people that you take care of, and that there's sports fans that are listening. Obviously, without names and specifics, tell us some cool cases. Tell us some of the, stuff with the. You said Dodgers, the Marlins, the Rams.
Yeah, being out in LA, you just see, especially the clinic that I was at, you just see a lot of really high level athletes that you would see on TV, and then also a lot of actors, actresses, musicians, and so you see a lot of high-level people that are titans of their industry out there. So, there's so many. Without giving names, I can't really.
Yeah, but I mean, so tell us some of those surgical experiences. Like, what were some ones that stand out? Say, I got to do this for this type of person, whether it was a linebacker or a pitcher. What surgery and how did that look? Because that's the inside scoop that your average person doesn't get to.
Yeah, just the routine sports medicine stuff is just a higher level of expectations, so it's got to be perfect. So just even a routine ACL, but if they're a future Hall of Famer, that's a lot of expectation to get them back, and like
recovery
the Tommy
time.
John, so all of it is what you would say routine sports medicine out there, but it's real pathology, and it's really, really high levels of expectation. You got to get them back. So it's all, it was all very, very interesting.
Was there a case that you had that you did that you say, man, I learned from that, I should have done this or that, and what did that look like?
Yeah, of course. I mean, I think, any, all of the cases, I mean, you can take something from, but there's certain hip cases that stood out that were, a little more challenging for everybody, and it just helped to the next time you see that to change and do something that would work a little bit better.
Yeah. The Paley Institute where you are now, they're doing some new things. What are some of those new things?
So the Paley Institute has always been known for, since they got down here about 14 years ago, as Dror Paley brought this down here, was limb lengthening and deformity corrections and a lot of rare pediatric conditions, musculoskeletal conditions, and more recently, we've kind of been branching out into like sports medicine, like myself, and some degenerative spine things, and a little bit more of the routine conditions, but we still do a lot of rare conditions, a lot of really complicated things that other community doctors just don't want to do. Just because we have a lot of experience with it, and so we just do whatever you need. I mean, that the Paley Institute has a physician for you to get you to where you want to be.
Yeah, different than traditional. It sounds like traditional orthopedic.
Yeah, it's like it's essentially built like a community practice, but the surgeons that we have and the conditions they treat, it's more like a university. And how we treat people and the conditions that we do take care of.
Yeah, with limb lengthening and the necessity of that, it seems like there's a couple ways that whole area is going. But when you think of the technology, right, and you look at, I mean, when I grew up, there was the $1 Million Man or the Bionic Man. And how do you see that playing into all of this?
Well, so the one of the big things for them for the limb lengthening was that they went from just X-Fix, which is pins and rods on the outside of your body, to these now they can do in certain situations these rods that will expand with your bone as you grow, so it's on the inside.
Wow.
So it's with huge. A magnet.
Yeah.
And then for what I do, just the technology and arthroscopy and,
right.
and what you can do with the instruments that you have is incredible now.
Yeah.
And things are starting to, as AI is growing,
Yeah.
the operating room is going to be integrated with that, and that's probably going to be the next major change that happens in an operating
AI.
room. Yeah.
Why? Because it's going to give a sort of a plan of operation.
Yeah. Where
is that how it's going to be used?
Where you should make certain cuts if you're doing a joint replacement, things like that. I mean, there's already robotics, but that's just going to take a next step.
Yeah, the robotics is the Da Vinci, and that's being manned by a physician.
Right.
So I've worked in conjunction with that, doing acupuncture during a Da Vinci surgery, so I was able to view that.
Right.
So the physician is actually looking at it into a little screen, and there's the controls are at their hand, and then there's like a robotic arms, about 8 of them or 10 of them, I don't even know, doing all these minor incisions.
Yeah.
So you're saying AI is going to be integrated into
I think that'll be
well.
the next big change that we have in medicine in general. Just because information is so rapidly processed and can help the physician, wherever it may be, make their decision and do it properly.
So in essence, it sounds like the physicians will be feeding this information,
right?
But in the end, it'll be replacing the physician.
It just depends on what what kind of physician you are, I guess. So for the operating room, I don't think that's something that you can just replace. And but I think it can aid in a decision that you're making.
So right now, you're doing well. Your people get to see you, get to benefit from you. How do they find you? Just share the...
Yeah, so you can go online and search the Paley Institute or my name. You can just look up my name as well, and it's easily accessible. You can always give the Paley Institute a call as well, and then my email address is online, so you can always reach out to me if you have a question or anything. I'm always happy to answer any questions people have, or set you up with an appointment.
Yeah. When I look at you, I look at the future of orthopedic medicine, but it's now,
Yeah.
The future's now. So I'm glad that people get to utilize you and learn from you. And I like your point of view and things. And I think that that's what is lacking in a lot of, there's almost like this, a lot of surgeons may have a complex where they don't want to share all of this, whether it's the experiences that weren't too positive versus the ones that, so that they learn from it versus all the successes, which I'm sure your successes are more than anything else. But, it's good. It's really important because that is what cannot be replaced is the human content.
Correct. Yep.
Right. So, and that's one of the things I love about what I do is that interactivity that we can share. So this has been another Maximum Health Quality Living. If you missed any portion of this show with Dr. Zachary Mcvicker from the Paley Institute, please go up on the podcast, any podcast format, and pull it and listen to it. Very informative, and hopefully will help you with your future decisions if you should need orthopedic care. And again, this is brought to you by Vel Health, velhealth.com. Wellness within reach. See you next time.